Hi, my name is Jess Whitnauer and I am a dietetic intern. Today I will be performing a nutrition-focused physical exam on a patient to identify signs of macronutrient deficiencies. First, I will begin by getting the patient's permission to perform the physical exam. Hi, Mrs. Deal. How are you doing?
Hi, good.
Good. I'm a student here at the local hospital and I was hoping to perform a physical exam on you today to examine some areas for fat and muscle. Would you be comfortable with me performing this on you?
Yeah.
All right, perfect. Thank you.
I am first going to examine the patient's hair. I am examining the hair for shine and if it is easily plucked. During this time, I may ask questions like, do you find an unusual amount of hair on your pillow at night or when you comb your hair? Abnormalities in hair shine and if it is easily plucked can indicate a protein deficiency. Next, I am going to look for any bilateral temporal wasting by gently palpating the temples. I am looking for tissue deposits to indicate healthy muscle tone. I am identifying any scooping or hollowing of the temples for a healthy amount of fat deposition. I will now be checking the fat pads under the patient's eyes by palpating under both the eyes with my thumbs. I'm looking for any sunken eye orbitals to indicate a severe fat loss. Hydration status can also be determined by sunken eyes. Here I explain to the patient that I want to check the corners of the mouth, lips, and tongue for any abnormalities. I am checking for redness, inflammation, or sores of the mouth. Dehydration can also be identified through chapped lips or limited saliva, or the caking in speech patterns. Now I will ask the patient to sit up in her bed so I have access to her back. I will examine under the scapula for muscle wasting and definition. I examine the clavicle and the deltoid region next for any muscle wasting or pitting. If the scapula is protruding outward, it can be a sign of muscle wasting and also of loss of muscle tone. I will now ask the patient to extend their arm forward and push slightly into my hand. I will assess the back muscles by palpating the engaged muscles around the scapula. I am now explaining to the patient that I would like them to bend their elbow to a 90-degree angle. I will evaluate the triceps and the biceps by rolling my fingers to separate the fat and muscle layers. I am checking for severe subcutaneous fat loss by noting the skin between my fingers. If my fingers are touching and only skin is between them, a severe fat loss has occurred. While the patient is still sitting up, I will find the ribs and the top of the iliac crest. I will pinch this tissue slightly to note fat stores between the waist. Ideally, this is done standing up. Here I am asking permission to examine the area between the thumb and index finger for fat deposition and muscle tone. While I'm here, I will examine the nail beds and quality. If the nails are lackluster or have lots of ridges, a protein deficiency is suspected. I will now press down gently on the nail beds, taking note of how long the depression lasts. This, along with any bruising or bleeding, can indicate a lack of protein in their diet.
Mrs. Steele, is it okay if I examine your legs now? All right, perfect. Thank you.
I will now get eye level with the patient and uncover the leg I am examining, making sure to keep her mostly covered. I will examine the anterior thigh and knee area for any depressions or indications of extreme tissue loss. Large divots would indicate a loss of fat. Moving down the leg, I will note the tibia and any protrusions I see before going down to the calf. Like the triceps, I will gently roll my fingers between the tissue layers to see the muscle tone and if any fat loss is indicated. Lastly, I will move down to the patient's ankle and pressing down slightly on the top of their foot. By doing this, I can see any edema or fluid accumulation that has occurred. This tells me a lot about circulation, hydration status, and inflammation. The nutrition-focused physical exam is a unique tool that dietitians can use to monitor weight loss, check for signs of malnutrition, and provide an evidence-based approach to patient-centered care. Thank you so much for watching.